Welcome back and thank you for staying with us. Now, the Health Minister just concluded his briefing on cholera in the country, and we've got our senior reporter, Aviwe Mtila. Aviwe, the Health Minister reminding us that already in February we had cholera cases in Johannesburg and then over 170 being treated in the Free State early this month. But of course we saw the rapid increase and most importantly deaths in Hammanskraal recently. It seems he's trying to make us understand why we cannot conclude that the contamination comes from water.
Certainly, Maseko, you mentioned that first outbreak, of course. That was first of 3 outbreaks that we've had this year. That first one initially coming in from 2 sisters, we understand, that had traveled to Malawi. And the suggestions are, although there's nothing conclusive at this stage, suggestions are that they may have been imported cases. Those were the first ones from the 5th of February, and we understand 1 child passed away there. And then there was a second outbreak in the Free State, 9 total cases with 1 death there. And of course, the recent outbreak in Hammanskraal, with the suggestions being that it may have been from a gentleman, a policeman that was in the Hammanskraal Police College. That was the first detected, case of cholera, and that person's still in hospital, but doing well. But there've been a number then of influx in the, in the cases. This brings the question that if it's not the water source, which the suggestions are, it could be imported case. Then I'll be speaking to the Health Minister, Dr. Joe Phaahla. Thank you for joining us, Minister. And I ask this then, maybe once more, on just clarity in terms of maybe your readiness as a department, because the suggestions are, although there's nothing conclusive at this stage, that this may have been an imported case leading to these 3 outbreaks. Are you ready then as a department for a bigger possibly outbreak if it does happen?
Well, we definitely have to be, because it even doesn't depend, as I've said in the briefing, that even the final source in this bigger outbreak in the Hammanskraal area, the drilling down may never even confirm whether the gentleman who came from Mosina is the one who carried it into the area, but it's immaterial in terms of readiness. The fact of the matter is we have cholera. As we had it beginning of the year, we are lucky that the chain seemed to have been broken. It's now bigger. That chain is bigger, because a lot more people have been infected, even some who may not have even been tested because they recovered quickly, not requiring a laboratory confirmation. But the fact that there are many more people who had diarrhea, both here in Tshwane, in Hammanskraal and Greater Tshwane, and also in Free State. What it means is that, as my colleague Dr. Kalu of the WHO was saying, we have to just up our readiness across all provinces and across all districts in terms of, one, the messages of prevention, in terms of the basic hygiene measures, in terms of hand hygiene, handling of food, security of water, that our water authorities must continuously check the quality of the water. But where we have any suspicion, especially untreated water, that the treatment which is possible, boiling, I know it's a problem with load shedding. We can also use the household, what is called a jig detergent, just the two teaspoons into a 10-liter. We'll just clarify all those messages in terms of where definitely you are not sure about the water part, but just basic hand hygiene, food handling hygiene, in gatherings especially, all those, we will be upping our public health messages in that regard, because it's not whether. We have to assume it is going to go into Limpopo, it's going to go into Northwest, now that the cases which have been reported are those which have already been accounted for, but they are resident in parts of Northwest, which are bordering Gauteng. So what it says is that, because also people travel, there are some who have not been laboratory confirmed, but who are going to be traveling, sharing food, sharing other utensils. So that those messages of readiness, and also index, what we call in medicine, index of suspicion, by the primary health workers, so that when people come, especially they get the clear history. If somebody comes from an area like Tshwane, where there's been already indication, if they have any signs of abdominal problems, that a suspicion of possible cholera must not be forgotten. So there are all these measures which we are going to be drilling, as prevention, but also in terms of early detection and treatment.
I was about to ask, you touched on actually my next question in terms of the readiness as it could move to other parts of the country. And yesterday we heard from the Minister and the Presidency that right now it's concentrated in Hammanskraal, and every other part of the country in terms of water usage can be safe in that regard. But judging from what you said, you seem to suggest that it may have moved from Hammanskraal, given that there have been cases reported in the Montana Healthcare, that's north of Pretoria. Has it already moved elsewhere outside Hammanskraal, Minister?
It is possible. The fact that even though there's 111 Netcare military hospital, our team still has to check those. They are traveling. Their area of residence, and also the areas which they have touched and interacted, where they might have shared certain things, food and water and other stuff with other people and drinks. So those are going to be checked, but it does indicate that you would assume that somebody who went to Montana, we have to check. It might still be somebody from Hammanskraal who, because they've got the medical cover, went to a private hospital. It might be somebody from the military who comes from Hammanskraal, who went to number 1 military here at Tshwane, but we don't know this. The team is going to go deeper into that, but it indeed affirms the fact that the risk is not limited. We have to be, everywhere. We just have to watch when people present, and also make sure that at the community level people are aware of the risk.
And talking about community level, I was in Hammanskraal a bit earlier on. Well, for the last 2 days, they complain of the quality of water. Some residents showed us footage of feces coming out of taps. Surely this is a huge health concern.
Well, it's definitely a huge health concern, and that's why we do interact with the municipality and also the colleagues from the water and sanitation department. I've seen on TV those kind of pictures, and one really relies on the people who are in the front line service of the water provision to assist in terms of making sure that those kind of things don't continue anymore.
Let's go to the health ombudsman. We know that the term of Prof. Makgoba has come to an end. When can we expect an appointment, and who's going to be taking over the professor?
We will make an announcement. We will make an announcement tomorrow because Professor Makgoba has done a very good job, first ombuds in the country for health. And unfortunately, in terms of the law, which is possibly the correct approach, the clause in the National Health Act which establishes the Office of the Health Ombud stipulates that it will be a 7 years non-renewable appointment. So tomorrow I will announce the new ombud.
But we've heard from this current ombud that there are 2 provinces that are dysfunctional in the healthcare professions. That's the Eastern Cape and Gauteng. And Eastern Cape is mentioned for having an embarrassing healthcare system. I need your take on what needs to be done and how soon those 2 provinces can be tackled.
Well, we're working very closely with both of them, including with their premiers. We've identified issues. I've got a team in the department led by the DG and other senior officials who have been working very closely, and I personally also I've been working closely with both provinces. It's, at least in terms of Gauteng, because we also headquartered here, I do keep a very close contact, and there are a number of issues, there are a number of interventions, both with the previous premier and the current premier, which we have agreed upon, and we are monitoring those at leadership level. Very serious instability. We are working with them to find an HOD, for instance, in Gauteng, but there are other areas where there is also a lot of acting managers, which also have to be attended to at senior level, and also at facility level. There's also a number of gaps. And I don't want to go into details, but we are working together. We are supporting them, we are monitoring. And then I will be I've got a team which went to the Eastern Cape. They gave me a report of some of the things they've identified. We've agreed with the MEC.
What are those things, Minister? Is it politics? Is it the actual management of these facilities? What are the issues?
One can essentially bring them down to top, just stability and focus at leadership level. I mean, if you look at Gauteng is on its 5th MEC in this administration of 2019 to 2024, and they also on the 5th or 6th acting HOD for health. So serious instability in that regard. So leadership, management. If you look at the Eastern Cape as well, there's been instability both at political and administrative management. At least they've had an MEC for some time now, almost 2 years, and a new HOD also for almost 2 years. But there are still issues at district level which we need to discuss with them where there's instability. So there are a number of districts which our team has visited where issues have been raised, where we need to drill down with them and even down to some of the key facilities where we need to agree on the process of finding competent managers. But there are also objective factors, which are also, unfortunately, also linked to some of this. Eastern Cape has been suffering from huge litigation costs. I mean, in the last financial year alone, the financial year 2022 to 2023, they paid no less than 900 million, which is a loss to the services. So as a result, the budget is, they're sitting with about very huge, about 4 billion rand in back debts, what we call accruals in financial terms. They have to make sure that, so in terms of keeping up with supplies, renewing contracts for critical supplies, if you are owing close to 3 to 4 billion rand back debts, that makes it very difficult. So those are some of the objective factors which complicates all this, and I am going to spend some time with the Premier and the MEC in the next few weeks to address those. Yeah.
All right, thank you very much. That's the Health Minister, Dr. Joe Phaahla. Going to spend time with the Health MEC and some of the leadership, of course, of the two provinces that have been described as dysfunctional when it comes to the healthcare facilities. That's the Eastern Cape and also the Gauteng. That's, of course, at the hands of the Health Ombudsman, which the new appointment, we're told, will be made tomorrow. Yeah, but the briefing itself, of course, was around the cholera outbreak. Now the suggestions are that it may actually have been important, given that this is our third outbreak, and the initial one being detected from two sisters that actually went to a funeral in Malawi, and upon their return early February was when then the first outbreak ensued. That's of course on the 5th of February, leading to one death, and then we've had two others, one in the Free State, 9 cases and 1 death, and then the most recent, of course, which has been the biggest yet, that's in Hammanskraal, with those 23 people losing their lives.
All right, Aviwe Mtila, live for us in Pretoria.